Okay, so I can be found, we are officially recording as of right now. I can be found on Instagram. I just updated my Instagram to actually have the handle of ResiPrep for people that are looking to find me. But I'm getting a lot more of my interactions on LinkedIn. So if your classmates are following me, I may actually reach out to others to connect. But if you have questions, I'm finding LinkedIn and Instagram to be like the two most effective ways that people are able to shoot me questions and curbside me and get responses rather quickly. For anybody who's attended the last workshop, we really focused on actual interview prepping, right? Different questions that you could get asked during your interview process, and different ways to go about that, whether you've prepared for it or not, what some of these questions are really intended to do. I'll go over a little bit of that today, but I know that like a lot of the emails I got were people really nervous about the clinical challenge section of their interview prep process and really wanted a lot of the time to be dedicated to that. So we will go through and spend most of our time working on that. So I have a generic case that I presented, and we'll go through and talk about how some of these cases are built and what they built them to do or not to do, what they build them to expose in your knowledge gap or your problem solving skills, so on and so forth. And creating an appropriate therapeutic care plan, right? And figuring out based on this poorly written case, they're always poorly written and it's intentional, but it's to really try to see if you can pick out that it's poorly written and pose those questions and say, well, how come I don't have this? Or where is this? Or I'm unable to decide between these two drugs because I don't have this data. And so I'll talk about how all those things and why they're done and how you could navigate that so that you're not panicking and feeling like, oh my God, there's something I don't see. It's intentionally done that way. And there are drug information, some programs, especially in the virtual world of interviewing, that have done away with the clinical challenge because they're not able to sit down with you and have the discussion. And so they're actually just asking you to send in a clinical pearl or do a drug information question. So I'll touch on that as well. The goals of any interview, I just wanted to review this because some people tend to like fixate on one aspect of their interview. You are a full like 360 individual and the program is looking for well-rounded people. There are some people that interview really well in the situational portion and the questions they're asked there. But then when they're asked other questions about like why residency and things like that, things that programs assume everybody is prepared to answer, they struggle a little or they get stuck a little. And of course, it's to address any reservation about your compatibility and your qualification. That I think is your biggest burden. Your biggest burden is to really look at your CV critically and objectively, right? Like part of what I do is to make sure that you know what all your vulnerability areas are. I will tell you like, okay, there are not a lot of community service on your CV, or maybe I don't see any scholarly activities. Like, have you taught a class? Have you published anything, even if it's in a newsletter that's not peer review? I make sure that I expose those areas for you so that when you go to your interview, you're not blindsided and have to scramble to figure out how you're going to describe why this gap exists. Because there's a reason for why everything you've done and everything you haven't been able to do exists. And you can prepare to basically explain that in a way so that it isn't a negative for you. And the program will actually be interested and say, oh, here's an opportunity for us to contribute to someone's knowledge in a unique way because they haven't had this opportunity this far. And so this is a huge part where I really focus a lot of my energy because everybody's able to say everything they've done. But the compatibility and qualification and making sure that you address any reservation the program has about that, I think is one of the big things that kind of will separate you from the pack. The interview day ground rules, this is gonna be quick. Just if you wanna test your equipment, like all of this sounds super simple, But some of the advice I have for you is because it's happened to me where I'm interviewing residents and I didn't take the time to make sure like my technology was functioning properly, and it's humiliating. So it's like this is scheduled, they don't cold turkey call you, it's scheduled. And so things like equipment issues are just difficult to forgive and overlook, and it could happen on both sides. It's just the pressure is higher for you to just be completely perfect, right? They can have technical issues and it's not a big deal, but for you, it's going to be a big deal. For gentlemen, it's okay to wear a bold tie, right? Like a statement tie is fine. Some people completely do away with the tie and they actually go with the bow tie. And I know that like some people talk about how at the interview they were asked, is that a clip-on or did you actually tie the bow tie, right? I don't know if there's any sentiments about it, but I had one candidate who actually used this opportunity to describe, like to really make himself stand out, and that he said, oh, until 2 weeks ago, I had no idea how to tie a bow tie. So I YouTubed it and I learned how to do it and I practiced for a couple of days. This morning, it took me 10 minutes to do it. And that's very impressive because it's like, oh, there's a limitation and he took steps to fix it. So he didn't show up with a clip-on. I don't think the interviewers would have cared that it's not a clip-on. It's another opportunity to showcase the type of person you are and how you problem solve. Gentlemen, like besides your socks, besides your tie, your socks is another way for you to be bold and make a statement. As you sit down and your socks show, like some people could be like, oh, interesting, cool socks. Always have a story with the socks. If you decide to do a bold socks, it just breaks the ice, because part of what you're trying to do is to really portray yourself like, I'm a regular person, I'm a fun person, I'm a personable individual. I like to work hard, I like to get things done, but I have a sense of humor, and it's like I'm not a super awkward individual. So things like a tie and socks is a really nice way to like break the tie. Ladies, please wear comfortable shoes. If you're doing an on-site interview, chances are they may give you a tour. COVID regulations have kind of changed how we go about this, but if you're on the facility, you would likely get a tour of at least the pharmacy department. That's going to be difficult to do if you're in shoes that are uncomfortable and you're focused on just not being in pain instead of focusing on interacting with the people you meet and being pleasant with everyone you meet. It's nice to meet everybody, like just everybody you meet. It's so nice to meet you. Thank you so much. I'm so happy to be here. But it's nice, like just the manners and stuff. It just makes you so much more relaxed, and the other people you're talking to relax as well. Lipstick and gloss being nude, nails being cut short and neutral colors. Just don't wear perfume or cologne. This is one day you can skip. It's going to be okay. If this is something that's every day for you, you can go back to that after the interview. But for that day, my recommendation is to hold it. Don't forget to smile. I can't believe, like, I'm doing a lot of video practice with people right now, and they're super serious. They're just focused on delivering the message. You should smile. Oh, I thought that was a question coming through. Sorry. Please mute your phones. Thank you. Or your microphones. Thank you so much. Don't forget to smile. It makes you relatable and likable, which you're not going to believe the power this has when they go into the room to discuss the rank. A lot of people are not going to remember your faces unless the program takes pictures during the interview. They're not going to remember your faces, but they're going to remember their experiences and how they felt. And it's always so amazing to me when I'm sitting in the rank meeting, the things that we are going back and forth about. And it's just like, she just seems so relaxed, or he was so personable, and he smiled the whole time. I just felt really comfortable. It's like, there's very little discussion about the CV and the grades and these exceptional accomplishments. It's all about how comfortable the interviewer felt. So don't approach it like I just have to be on my A game and be stiff the entire time. I promise you that being yourself is not going to hurt you no matter where you are. Professionalism and the standards of professionalism are going to be paramount. Being early, it's just never going to hurt. I usually think that a 15-minute is great. When you show up sometimes more than 15 minutes, they're still getting things ready and they could feel a little under pressure. because they're also trying to impress you. Remember, you're going to submit a rank, and that's going to be based on how you felt about your time there. So they are just as stressed as you are about making a good impression on you. But I think arriving 15 minutes early, especially because more than likely you're going to arrive in a lobby and you need to be picked up from that lobby and escorted to the main pharmacy, 15 minutes is going to be a good time to get that. If there are other candidates on your interview, just be nice, like just be kind. It's okay. It's not Game of Thrones, guys. It's going to be fine. Don't come in there and think that this is trial by combat. And if you just completely don't obliterate this other person you're interviewing with, you've missed out on an opportunity. It's not Game of Thrones. It's an interview for residency. You're interviewing them, they're interviewing you. And be courteous, wish the other candidates well. If you guys are sitting in a conference room, how far did everybody have to come today? Did any of you fly in, or any of you local? What's there to do? I'm here till tomorrow. I'm interested in sightseeing or seeing something. What's open? It's COVID season. Like if you're in a new town. So I just think that personability is not going to hurt. It's going to be okay. If you're on an interview, you're on an interview until you leave campus. I don't know why I have to say this, but I do. Don't start ripping your tie off when you walk out of the pharmacy department. Don't be so eager to get on Instagram, or don't have your phone out while you wait. I always just think, leave your phone in the car and it's going to be okay. It's just a few hours. And your social media is fair game. Different programs have different approaches about how they do this. And different candidates have different strategies in how they protect themselves against this. They may completely deactivate all of their social media accounts until interview season is over, or they may completely change their social media name so that they're not searchable under their name. If your social media is dedicated to your involvement in the community, if your social media is part of the brand you're portraying to a program, please don't ghost your account. You want them to see that, just in case they go see it. If there's anything that you're doing that is in line, like for me, I was APHA Region 2 delegate, right? I was involved in SNAFA with their kidney disease initiatives. I used my social media a lot to share all those things with my family. I was not that close from home. So I wanted my family to always know the different things I was doing. My social media was also very centered around pharmacy school. So I would share things on there and they would bring it up at the interview, which blew me away. It's like, I saw that you guys had an event at a senior center, and I'm kind of like, that just happened. So I know that's not on the CV I submitted 2 months ago. How do they know that? And they're like, oh, we search your social media. So it's fair game and they will do it. Just be mindful. I do have a chat in here. Hi, Joy. If you have a private social media, Instagram, should we keep it private during the interview season? I don't think so. So here's the thing. You do have a right to your privacy, right? If you switch your account status from public to private, then they can't view it. They can't see it. They essentially don't have a way to formulate an opinion about it. But you don't know who knows whom and stuff. So if they're super curious about what you're doing and want to check your social media, or if social media access is one of the things that they feel like they want to see, then you could put yourself at a disadvantage by having the account private. Like that's a double-edged sword. And I think because of that ambiguity and that uncertainty, a lot of people just go ghost and deactivate the account until the season is over and they surface back up. So I think you just have to weigh the risk and benefits of the person who's doing this search and how that person could interpret what they end up finding. If an account exists and that account is private, how could they interpret that? And so a lot of people, to just completely take this off the table, they will completely deactivate their social media. I hope that helps, Trey. So the clinical challenge, I know like a lot of people are sitting and they're listening and they're being super polite. This is what they literally tuned them for and wanted to know what needed to happen or how they needed to approach this. The purpose of this is simple. It's not simple, but there is a way where you can approach it and try to minimize your anxiety around it. I just feel like for me, when I'm anxious, I can't seem to just put my best foot forward. because all of my energy is going into shaking the nervous energy away, right? And this has served me well because it's just made me an incredibly prepared individual. Whether it's a meeting or it's a presentation or whatever it is, I am super prepared because I don't want to be nervous out of the possibility that something could come up and I didn't look that up or I wasn't prepared for it. Do not guess. Like I said, they are going to ask you questions that they know. They know. You just don't have the expertise, exposure to be able to know the answer to this question. And the key that they're trying to assess there is, if this was a real patient, your uncle, your mom, your sister, would you guess? If the answer is no, you would not guess. Just don't guess. Because in real practice, we do not guess. We always search for researchers and always reach out to other people with more experience to guide us. So don't guess, right? The almighty, I will look this up in a specific place to confirm my answer. That is what you do to get out of a guess situation. Sometimes I've done this where we ask a candidate a question and she's like, I'm not sure, I'm not comfortable guessing. So I will walk them through it and say, where would you look to find it, right? And then they'll tell me I would probably pull up the drugs monograph and go to the adverse event section to see what's there. Okay, so say the adverse event tells you that upset stomach is the most common side effect associated with this. What concerns do you have? These things can take shape depending on the person that you're talking to. They could prompt you and coach you and help you make a decision. Versus somebody would say, okay, they said that they don't want to guess and they were able to tell me where they'll go look to confirm their answer. And that's acceptable for them. But I want you to be prepared that this will depend on the person you're talking to and what they are interested in finding out about you. They may prompt you and things like that. If they say guess, like if they flat out say, I've done this as well, guess. I want you to guess. And they're like, you're like, okay, well, maybe sensitivity to light. And I'm like, okay, why did you think it's sensitivity to light, right? Your guess should be accompanied with an explanation. That is the only way that your guess is going to be considered. So always say, just based on the mechanism of action of the medication, I'm kind of inclined to think that it would more likely cause something with like visual disturbances, but I would definitely have to look that up to be sure so that I counsel the patient on the appropriate thing, right? They want to see how you think through your problems. They want to see how you think, how you respond. They may or may not tell you that you will have a clinical challenge. You could be in the middle of a conversation and they just throw out a question and they ask you like, what is the appropriate washout period if you're going to take somebody from lisinopril to Entresto? They could do whatever they want, unfortunately, right? And so this is the cause of the nervous energy. But the idea is like, how do you deal with stress? Like, how do you respond? Your basic pharmacology, just review it. And we'll go over what the common classes you should absolutely review and make sure that you have more than just good command of, because these drugs are just so commonly used, regardless of what you're applying for residency. It's paramount that you know what they are. For drug information, I honestly think that this systematic approach to answering drug information requests from ASHP, it is by far the single best document that I have seen that clearly outlines for you how you need to go about answering any drug information response. If you are a person, does someone have a question? I see there's something about what is your intake on answering the question in a form of a question? I hope my question made sense. Okay, so Joy's question is, what is your intake on answering the question in the form of a question? So your question, I think, makes sense. So I'm just going to give a scenario. So if someone asks, do you have any concerns about the fact that this patient is starting Entresto this morning and their last lisinopril dose was last night? So it's only been about 8 hours since the last lisinopril dose. Either the question is too vague or you're not certain about what they're asking. So you respond, do you mean like the washout period? Right? So the answer is is right, but you didn't really answer it. So if that's what you're saying, I want to strongly advise you not to answer that way. Yeah, okay. So Joy, that's what I mean. You mean like the washout period? So you want, yes, Sahara, yes. So you want to make statements because you know that there is absolutely, with absolute certainty, that there is a washout period between ACIs and initiation of an ARNI. This is not a dispute, this is fact. You're armed with this fact. So maybe you can engage in a conversation. You're like, oh, that's interesting, because usually there should be a washout period of 36 hours between an ACI and initiation of an ARNI. Their question was poor-ish, but you made a statement that's factual that may lead to other questions like, okay, the lisinopril dose was this, is the Entresto dose correct? That's, in my opinion, slightly more advanced for a student level, but I teach it to my students, so I always challenge residents with it, or residency candidates with it, but that would depend, again, on the interviewer. Great questions. We kind of talked about this a little bit, how you think. The aptitude part is what kind of I want to put to your, I want to bring to the forefront. I just don't think there's anybody graduating from pharmacy school who isn't intelligent. That is just the way I work, and that's my benchmark, right? It's like knowledge gaps I can fix. So like when I have students, I would go to any length necessary to make sure that their learning experiences are being maximized. Knowledge gaps, we can fix that. If you just don't know it, we can fix that. But I cannot fix laziness, like I can't. So the moment that I'm able to make an assessment and know that you're phoning it in, you're just here because the school says you have to be here, then my motivation to want to go above and beyond is kind of like, okay, well, we need to have a come to Jesus at this point, because I need to know you're not motivated by the learning experience because this is not something that's of interest to you, or you're not motivated because your skill level, like you're bored with what I'm giving you. You're interested in something slightly more challenging and more, and that's been my experience. Students that I have had where I felt like, okay, they're not really tuning in. I'm not getting much on my return on this investment. And I have a conversation, and it's usually frank and honest. I legit just don't have time to beat around the bushes. So I usually find out sometimes they have no interest in anticoagulation, and I'm forcing them to do DOAC and warfarin education. Other times they have zero interest in heart failure and metabolic disturbances, and I'm asking them to deal with heart failure, diabetes, and CKD. We can figure out what you're interested in. If industry is your flow, yes, I'm in an M-Care clinic. We can work on resource and relationship establishment and getting my clinic more resources, education for the pharmacists that rotate through. I can tailor it to your end. This interview will be no different. The energy you bring will be the energy you get back. You can tell that they're excited about meeting you. They're excited about talking to you because you're excited to be there, right? So the clinical challenge, it has a